Now, the biggest thing that comes out of a conversation about side effects of isotretinoin is, does it cause depression? The answer is no, it does not. One thing we need to think about here too is that acne vulgaris in and of itself is known to have a substantial psychological impact on almost all the patients who have it, okay? And that manifests as depressive symptoms. So patients with bad acne or even mild to moderate acne are not happy about their skin, which makes their general well-being not so great, okay? So if you've ever had acne before, you'll understand what I mean. It doesn't lead to a positive outlook, okay? So when you have acne, you can feel depressed. That's a well-known association. Where this idea comes from, that isotretinoin causes depression, is from a study published in 1983, and it asserted that oral isotretinoin could cause depressive symptoms. And since then, there have been lots of confusing publications that kind of fueled controversy on this subject. This is important, and I need everyone to listen to this carefully. The studies that have found a positive association between isotretinoin and depression concluded that it was an idiosyncratic effect occurring in a minority of patients who often had a past history or family history of depression. So idiosyncratic means it couldn't be predicted, and it wasn't directly related to the drug as in a dose, okay? So it seemed to be a association, but not a causal relationship. Most studies have not found an association between oral isotretinoin and depression, but rather have found a beneficial effect of reduced depressive symptoms with the treatment. Now, that is very interesting, okay? There was a systematic review and meta-analysis performed in 2017, and I've put all the references I've used in the notes below, and they looked at the association between oral isotretinoin and depression. They reviewed 31 controlled or prospective non-controlled studies and evaluated data from 2,939 patients. They used these depression scales, okay? And patients scored themselves on the depression scale prior to treatment and at the end of treatment. And it did not show a significant increase in depressive symptoms with isotretinoin compared with those on other treatments. However, the scores that were close to indicating depression decreased significantly in patients treated with isotretinoin after completing treatment, and this improvement in their depressive symptoms began when treatment began. So withholding this medicine from people because they have depression or anxiety or mental health problems is almost unethical, at least it is to me, because oftentimes if you speak to these patients, the reason why they have these symptoms of depression or anxiety or mental health problems is due to their acne vulgaris. So I hope that is enough information or evidence-based to make you kind of feel better about this association if it's something that you've been concerned about.